12 services. Who's doing that? Right, okay, that's you then.
I've got a presentation with me, and there's also a handout on Rise's community offer that we can see that's anyone. So if I just introduce myself, I'm Louise, I'm the Children's Commissioner, and I think one of the main things I want to say today is this is week 3 in the new job. So I'm coming presenting information, but I may not be able to answer a lot of your questions, but what I want to do is to go away, get that information and get it back to you.
You could feed that back to the you can't answer anything.
Yeah.
You don't feel pressure.
Yeah. I want to do my best to find out some questions. So I've come to present about the RISE service. So this is the Children and Young People's mental health service in Warwickshire. I'm here to present from Warwickshire's point of view. So we are 1 year in to what is in total a 7-year contract. We've got a 2-year implementation plan to kind of get the service to where Country and Warwickshire Partnership Trust said they would get the service to, I think, with a kind of transition period to a greater focus on prevention and early intervention for children and young people. So the new service, the service specification and the outcomes that we wanted for the service were co-produced with children and young people, parents and carers and other stakeholders around the county. We had an organisation called Young Minds come in to lead on that consultation so that it was slightly independent to the local authority or to help as well. Going to the next slide, thank you. So the overall aims of the service is to have, like I said, an increased emphasis on prevention and early intervention, to have a single seamless service and to get away from having tiers, so you go in at tier 1 or tier 2, and to try and break down those difficult transition points. So if your needs escalate and you need to go from tier 1 to tier 3, I think the feedback that we were getting was that was taking a lot of time and it was a very confusing system, so we want to try and get away from that really. We want more integrated working, so these things don't occur in isolation. There are social care issues, there are education issues, as well as health issues that surround young people. So we want to have a kind of whole system approach. Part of that as well is supporting the whole family, not just the child. We want to have a focus on where there are complex issues around children and where we've got some of our most vulnerable children and young people as well. And there are different vulnerabilities as well. So we want vulnerable children to be wider than how some people have envisaged it in terms of just our looked after population. We've got young people who are involved with youth justice. We've got young people who have special educational needs and disabilities. We feel they're vulnerable as well. So I think the aim of the service is to help that resilience and that bounce back ability, if that's a word. And I suppose the aim is to make getting help easier. I think following on from what Health Watch has said, listening to families and children and other professionals, I think it can be really, really difficult to navigate the system as well as get into the system to start with. So we want a real focus on making it easier for people to get into the system. This service also goes from 0 to 25. Traditional children's services go to 0 to 18. And then what we were finding and what people were feeding back was you were going off a cliff edge at 18. And what we wanted to do is have a longer approach to kind of bridge those difficult transition periods. And then what we wanted was for the provider, the service, to go that extra mile to reach those people who need them the most. I think, again, building on what Health Watch was saying, feeding back from what other people were saying to us as well, was that people had to fit into very specific time slots and things like that, and we wanted to kind of change that. So that's what the aims were. The model that is there now, so we've got a single point of entry, which we call the navigation hub, That's open from 8 AM in the morning till 6 PM in the evening to try and offer be open longer so people can reach us. There's it's called a digital offer, so there's a website. On the website there's information and advice, there's videos, there's information about what the community offer is as well. And that goes on to our community offer. So Rise are offering, or starting to offer, more drop-ins, more group work intervention and more outreach work in the communities. I think I'll come on to this later, that this is kind of starting small and starting slowly, but now we're a year in as a commissioner, I want a real push on this is what we want for early intervention, and a real push on kind of the more community stuff. So there's clinical oversight of the pathways from specialist early health as well. And I suppose what we were looking at as well is, in the final bit, was a specialist multidisciplinary team, but also with the community hubs, is there might be slightly different needs in different communities. So we wanted those community hubs to reflect the communities that they're in, the different voluntary services that are around, the different youth groups that are around, if there are any, so that the support that's getting is more kind of multi-agency, more rounded and more specialist for the areas. Next slide. So, the 2-year implementation plan. The milestones that are on track at the moment are that we've got 2 hubs open already, one in ADOLESCENT, one in Stratford. So there are link workers in each of the hubs, and there are drop-ins and group work sessions in each of the hubs. The navigation hub is up and operational. The website is operational but is being reviewed at the moment with children, young people and families to try and make that better a year in. They've also rolled out the Dimensions tool, which is a way of families and schools accessing information, asking some questions to get some more useful information about where to go, what support there is out there. The integrated pathways that they've started. We've been rolling out a big umbrella across schools, and the service is piloting e-referrals at the moment. So that's the bits that are on track. There are areas that aren't on track at the moment, which I suppose is what I'm to focus on as I'm new enrolled. So setting up the vulnerable children's pathway, that's a priority at the moment, and we've got a multi-agency workshop going on in November, beginning of November, to get that online. Part of the offer is to have a chat function and an online offer, both for young people and for parents and carers as well, so that they can kind of, some people don't want to be seen face to face, so it's to give people as many opportunities to talk to somebody as possible. Extension of the adult crisis team, that's in the offing at the moment. What we're looking at is extending that from a kind of 9 to 5, Monday to Friday service to a 7 days a week service, to offer a more responsive service. So that's in process at the moment. And then the Nuneaton hub, that's been delayed as well. The delay has actually been with the local authority, with Warwickshire County Council, in terms of agreeing rents and handing over keys. So that's something that we're trying to kind of get moving ASAP. Okay, so I've put a little bit of information about current performance. I wasn't too sure about what information you would want. So waiting time to first appointment, it's quite a complex diagram. But what we're seeing at the moment is that there's an average of 7 weeks to first appointment. That is an average. There are a lot of people who are waiting longer than 7 weeks. And then the second graph shows you, so from first appointment, how long are people waiting for follow-up appointments? Because your first appointment really doesn't kind of get you very far. It's when you start being seen more often. So that's another key point that we're monitoring at the moment. And as you can see, there's been quite a steep reduction in those waits, but unfortunately those waits have started going up again. So that's something that we are really focusing on at the moment. So it has reduced, but there is still, as of July, I think that's gone up again, 110 young people waiting for follow-up appointments, and that's 110 young people too many, really. Next slide. Oh, sorry, I've got some more information that wasn't on the slides that I thought you might be interested in. So, RISE Warwickshire caseloads, they've got 2,649 children and young people on their caseload at the moment. What I haven't shown on there was the weights for ASD assessments, because that wasn't an easy slide to show that. But we have got, as of July 2018, 1,309 young people waiting for an ASD assessment, which is the thing that is kind of...
Can you say what ASD means?
Oh, sorry, ASD, autism spectrum disorder. So yes, and that's an increase from 321 young people waiting the previous year. So that is something that we really need to be focusing on at the moment. The longest, we do kind of shortest wait and longest waits. So the longest wait for the North Warwickshire area is 104 weeks, which is unacceptable, and we know it's unacceptable, so that's something we're working very hard with the provider, but also with the wider network in terms of how can we get those weights down, how can we get ASD assessments better. Okay, so future developments for year 2. So we want to open the remaining 3 hubs. We are hoping that the Nuneaton and Bedworth one, if we can sort out our internal property people, hopefully that will be opening within the next couple of months. Rugby in November and Warwick in December. We're trying to increase awareness of the Dimensions tool, because what we're hearing, the different meetings that I've been to in the last 3 weeks, it seems to be a really sketchy picture in terms of who have heard of the Dimensions tool. So some people are saying, I didn't know about the Dimensions tool until the school mentioned it. Some schools are saying, I didn't know about the Dimensions tool until a parent mentioned it. So we're really, that's another focus for mine in terms of communication, what we're trying to do, the Dimensions tool and the community offer, get that information out there. Like I said, we're working on the vulnerable children's pathway. The other key bit for us as well is the crisis care service. So the number of young people who are presenting either at Warwick Hospital or UHCW in crisis, maybe after like self-harm attempts or something like that, because they haven't had early intervention and preventative services. We're really focusing on that bit now as well. And part of that is looking at what we can do to support those young people and those families better, what we can do to prevent young people going into what's traditionally known as Tier 4, so being sectioned. Because one, that's not good for young people, but two, also, we don't have many Tier 4 beds in Warwickshire, so young people are going quite far away, which is putting extra strain on that young person and on their families in what is already a very difficult time. We're working to improve the online offer. I think that goes hand in hand with communications. You know, we want to get this message out there, otherwise the preventative and the early intervention work just isn't going to work. The other bit from a contracting point of view is working around the outcomes. So this is kind of the first time for this service that we are asking the health service to report on outcomes for children and young people. So we've kind of been helping them get up to speed and look at how are they going to report on outcomes. That's the work that's been going on for the first year, as I understand it. And then for this year, we're looking at baselining the outcomes, so that then we can set some really rigorous targets for the following years in the contract that we can monitor them against. And then my final slide is just to give you a bit more information about the children in crisis work that we're doing. So as I said, we're looking to the 2 pieces of work that's going on at the moment. One is around the acute liaison team and extending that. The other is we're talking to NHS England about, is there a better way that we can organise children in crisis work? Can we have more money from NHS England to do stuff more locally and more responsive, and possibly into people's homes, so there's a more community offer to stop young people going away into Tier 4 beds that are far away from home. that's some of the work that's kind of going on as we speak.
Okay, thank you.
Questions?
Comments?
I could give you 3 hours of questions. Obviously my doctor is on a...
So